This is a time to recognize the work that's been done and being done by midwives.
And we're talking to Frontier Nursing. Susan Stone is here, the president of Frontier Nursing University. Thank you so much for joining us.
Well, thank you. Thanks for having me. So,
Tell us about the role that midwives play and are playing more and more today, whereas some people might have the notion that this was something from years ago.
Right. Well, one of the things I wanted to mention is that we have this crisis in our country now with a rise in maternal mortality rate. In 1987, about 7 per 100,000 women died in childbirth. Today, it's about 28 per 100,000. So we're seeing increasing mortality, deaths, and increasing illness, with about 50,000 women being admitted to ICUs in the United States.
Any idea
that
why?
Seems counterintuitive, yeah.
Right. We think that we have the best health care in the whole world, but maybe we're not paying enough attention to how to keep people healthy, and so how to help people stay healthy. And that is one of the roles that midwives play, is that primary care role, that sitting down and talking to, when you say to someone, you need to lose weight, that's not very effective, or you need to stop smoking, but really helping people to stay more healthy. We know that midwives can play a very big role in doing that. As a matter of fact, in other countries like Britain, 50% of mothers are attended by midwives. Finland, 75% of mothers are attended by midwives, and you have much better outcomes. Now, I don't mean to say that we don't need obstetricians, because absolutely we need our obstetricians. Right. But when we work together in a team, it seems to have better outcomes. And so that is the role that midwives play in this country. We are increasing our number of midwives quite dramatically, especially at Frontier Nursing University, where we have 900 midwifery students enrolled right now. But that's kind of our agenda, is to just help people stay more healthy and participate in the healthcare system in that way.
I would imagine there's a comfort level that comes with having a midwife, someone that you become so extremely close with, I would assume.
Well, you do, and you know, part of having an effective care provider is being able to establish a relationship with your care provider. You're not going to tell your care provider that your husband is abusing you, or that, you know, some of your serious problems, if you're not feeling very comfortable with your care provider. And that is a role that midwives can play.
It sounds like very specialized training that they receive at your institution, right?
Well, yes, definitely it is. But midwives do, you know, we also have nurse practitioners, and midwives also care for women across the lifespan, from puberty to postmenopausal care. So some people don't realize that. So some of the care is the same, like how to take care of an earache. You don't want to go into your midwife and say, got an earache, and they say, oh, go over there. You know, some of the more simple healthcare issues are taken care of by midwives. So that, but of course, yes, there's a lot of some of you, it would be fun to come and see our models that actually deliver babies. So they start with models and then go on to participating in hospitals and birthing centers with real women. And yes, there's a lot of maternity care that goes on and birthing care, yes.
Well, this is National Midwifery Week. Answer the call to service. That'll go on through October 6th, and folks can check out your website and find out more about this week. The call's attention to all you do, right?
Yes.
Thanks for coming.
Thank you so much for having me.
Keep it here.